Good afternoon. My name is Andrew Cyrick, and I'm a Senior Healthcare Data Analyst for the Task Order 1 work. And today we're going to be doing a Superior Health Dashboard overview. So a few housekeeping rules before we begin. Please mute your microphone to reduce background noise. We're going to record this session for later use. If you have any questions throughout the presentation, please use the chat window. We'll also have a 10-minute interactive Q&A session at the end to answer additional questions. And then if you do experience any technical difficulties, please use the chat window and a staff member will assist you. Objectives for today will include accessing KeyMetrics and viewing the dashboard, navigating the various pages within the dashboard, filtering data by facility type, location, and time frame, and then helping you understand how to interpret the tables and graphs. So since the platform is web-based, we'll be doing a live walkthrough of KeyMetrics. Okay. So the first thing you'll need to do if you haven't done so already is request access to the KeyMetrics platform. You can do so by using the link here. Once you have your credentials, you'll enter your email and password and click Next. Now the system has what we call two-factor authentication, where it's going to require a verification code, either through email or by text message. You'll enter the code and then click Submit. And this is going to bring you to the main homepage here. So what you'll see is a list of surveys that your facility has access to. And we've already covered the data entry portion in a previous video. So as I mentioned, today we'll be focusing on the dashboard. Now, an important thing is the dashboard is blinded. So you'll need to find your NQIIC ID. And to do so, you'll hover over your username in the top right corner of the page and click My Entities. So this will bring you to a page that of all the facilities you have access to in the system. So in that case, some individuals have access to multiple and some may only have access to one. Now what you'll need to do to find your NQIIC ID is you'll actually need to click your facility name. So in this case, I'm going to select Midwest Superior Care Center. And when I click that, it opens up additional identifiers for my facility. And in this case, NQIIC ID is what I'm looking for. So once you have that information, you can go up to the top of the page here under Reports and click Participant Dashboard. So this takes us to the Superior Health Dashboard page. And at the top here, we can see there are some instructions just to help guide users on how to navigate the dashboard. So in this case, we're going to walk through how to use the measure selector to look at specific facilities, measures, and peer groups, as well as time frames. It's also important to note that you can hover your mouse over various graphics and tables that will to see additional information. And these are called tooltips. And then we'll also show you guys where measure definitions are in the dashboard, as well as more detailed information that's housed within KeyMetrics. So to begin, we'll go ahead and scroll down the page here. And right now, the dashboard is defaulted to the behavioral health page. And you can see that here at the top in the header bar, where we denote which page the user is on. Below that are the actual navigation buttons themselves to the various pages. On the far left, you'll see the measure selector and then the individual pages following that. To the far right here where you'll see the measure definitions. So as I scroll down a little more, you can see that there is a comparison chart here. So the comparison chart looks blank and it's intended to be that way on purpose. So for this particular measure, which we can see here in the header of the comparison section, for measure 1.1.4, where the population covered by interventions implemented for the particular time frame of December 2018, There are facilities included here, but the rates are all zero. So the graph itself is not populating anything because there's no rate associated with these facilities for this particular measure. Now, if I go up here to the measure selector, I can update that information. So you can see here we have measure, your NQIIC ID, date, and state. These are all filters available under the measure selector. So the first thing I'm going to do is I'm going to change my measure. So currently I'm on 1.1.4, but I want to look at 1.1.3. And this happens to be opioid adverse drug events. Now it's important to note as I change the measure, you can see that a note came up here on the page that just says no data available. Well, that's because if I look down here, my date is now in parentheses. And for this particular measure, it's not monthly data, but it's rolling year. So I just need to update my date filter. So in this case, I'll select September 2018 to August 2019. And now I can see that that has populated my particular chart. So I've made my selections and I'm going to go ahead and close my measure selector window. So now I can see the information has updated appropriately. I now have my selected measure. I can see my time frame here in the header. And then if I look at that comparison chart, I can see where my facility falls compared to the rest of the group. Now in this case, as I mentioned earlier, we do have the tooltips. So if I want, I can hover over my green bar, which is indicated as my selected facility. And I can see what measure I'm looking at, my NQIIC ID, the date of the data, and the rate or the score for this particular measure. So in this case, I can see my rate is 202.8. And then I can see that there's a bar for the average of these facilities on this particular comparison chart. The line indicates the comparison average is 208.05, which means my facility is slightly below the average. Now, if you want, you can hover over additional bars that will give you more information about other facilities. And again, it has the tooltip included so you can see what the particular rate is. So now that we've looked at the comparison chart here, we're going to go ahead and scroll down the page. Now this is where we get a little more specific for the selected facility. In this case, you can again see that we're still looking at the behavioral health page, but I'm looking at NQIIC ID 720010. So this is my NQIIC ID that I've selected in the measure selector. What it does is it provides additional information about my facility. So I can see I have detailed information here in the table with a start date and end date, a numerator and denominator, as well as a rate or a score for this particular measure. And that measure is denoted here at the top of the table. I can then use the scroll bar here to look at more recent data. So I can bring this down and see that for January 2020 through December 2020, I have a numerator of 99, a denominator of 4,407.76, which gives me a rate of 226.6 per 1,000 beneficiaries. Now, if I look below this, I do see there's also a trend line, which gives me some additional information about the selected entity. So in this case, we can see that the data trend down here indicates lower is better, and the green bar is my selected facility. So I can see the green included here, but I also see there's some additional comparisons. So I can see how my facility stacks up against the state of Michigan, the Minnesota state, and Wisconsin state. So those are all included here. And again, you can see with the tooltips, we have provided additional information about which measure, the date, time frame, and which particular line you're looking at. So scrolling back up, we're going to use our navigation bar here again at the top. The layout of the pages is very similar. So you're always going to have a comparison at the top with more detailed information about the selected entity at the bottom. So now I'm going to click over to our patient safety tab. And as I've clicked this, I can see now that the page has updated. So I'm on patient safety. I can see that here in the comparison header. And then again, I can see that my measure is now different. So I have the ability again to go ahead and change the information based on using the measure selector. I'm going to go ahead and open this again. I'm not going to change anything with my measure as of right now. I can see that I'm looking at the NQIIC ID of 920015. I'm going to go ahead and leave that. I'm going to update my time frame here just to see more recent data. And I can see that that updated. Now that I'm done, I can go ahead and click there to close my measure selector. And now I see that I'm looking at hospital utilization for adverse drug events related to opioids for January 2020 through December 2020. Again, I have my selected entity here showing as the green bar with a comparison average included on this comparison chart as well. So I can see again, since lower is better, I am a little below the average, which is great news. So again, scrolling down here to the bottom gets a little more specifics. So again, I'm looking at NQIIC ID 920015 for hospital utilization for adverse drug events related to opioids. I again have a table here showing detailed information for the rolling year time frame with the start date and end date, numerator, denominator, and rate. And then again, the trend line here just kind of showing how my facility is performing over time. So again, we'll scroll back up to the top here. Right now, our chronic disease link is not active. Chronic disease is more of a manual entry measure set. So we have not included that information here yet, as hospitals and other nursing homes and participants who are included in our Quality Innovation Network Quality Improvement Organization work are adding that data in KeyMetrics. So we'll go ahead and click over here to transitions of care. And again, we can see that that is updated here at the top, so I can tell which page I'm on. I again see my transitions of care comparison here at the top. So again, I'm going to want to make some changes here. So I can use my measure selector here on the left. And I can see I'm going to update my facility here. I can also look at, I'm going to leave the date here, but then I do want to update to a specific state. So if I go ahead and click Michigan, I can see that this is now filtered down to my applicable state that I want to look at. And what it's done is it's dropped me down to a couple bars. And again, I can see my green bar is showing here. So this again just allows me to filter the data down a little more. So I can look at more of an average for my particular state. And then as we include additional peer groupings in the future, you'll be able to add those additional filters on as well. Again, scrolling down the page, we have more specific information here. Again, the table outlining those particular start and end dates, numerators and denominators. We happen to be looking at the hospital readmissions per 1,000 beneficiaries, so that's included here. And then again, that trend line at the bottom, just giving additional information about the selected entity, Michigan, Minnesota, and Wisconsin state averages. And then the last tab here we're going to look at is nursing home quality. So I'm going to go ahead and click that. Again, I can see here I've navigated to that appropriate page. Now in this case, we do have the little different data set on this one. This is currently filtered to nursing home CDI, which is the C. diff infections. And this data happens to be monthly. So I do see that I can identify nursing home CDI for June of 2020. Now, because it's filtered down, you don't see as many bars here for this particular month. But again, I can use my measure selector and go back and look at different information. So I'm going to leave it on CDI for right now, but I am going to select a different entity. Okay. I updated that. I want us to look at, let's do December 2019. I don't see that bar popping up, but I'm going to change my information here. Let's look at nursing home falls rate. Now again, since I am changing measures, we can see that the date here has updated. So this happens to be a rolling year, so I'm going to go ahead and change this as well. Okay, so this looks a little better. So now I've selected a new measure, a different NQIIC ID, and then I specified my date range. Now you can see, even if I close the measure selector here, I can find my green bar is very small here on the comparison chart. So again, I'm going to want to add some additional filters just to see more information about this particular entity. So in this case, I'll open my measure selector up again. I'm going to filter down to Wisconsin, and I can see that I've filtered out some bars. And then I'm also going to update the setting to rural. And I can go ahead and click close once I've made those selections. And again, I can see my selected entity here is the green bar. So I can see that my facility is well below the comparison average for this particular group of looking at our nursing home falls rate for ADEs from October 2018 through September 2019, again, filtering to Wisconsin and filtering to rural facilities. And then again, I can look at other entities included in here that'll just give me the rate or score for their particular facility. Okay. So I'm going to update this again. I want to go back to nursing home CDI. I'm going to clear my filters here. I have the ability to do that. So you can see there's a little filter with an X. This is going to filter back to all. So I'm going to do that for both state and setting. Then I also see I need to select a particular date. So I'm going to look at, let's look at July 2020. So I can see that populates my comparison chart here again. And if I scroll down the page here, I'll again see entity-specific information. So in this case, I have nursing home CDI. I can see more recent information for my particular entity. Again, it includes the start and end dates. So this happens to be monthly, numerator, denominator, and a rate or a score. And then below that at the bottom, we have the trend line here, again, just providing additional information and showing our trending over time of how the facility stacks up to the state or stacks up to other states as well, Michigan, Minnesota, Wisconsin. Now, one last thing I'd like to point out, on each page, there is a measure definitions link. So in this case, since I'm on Goal 5 for the nursing home quality, if I click measure definitions, this is going to take me to those specific definitions for nursing home quality. So I can see each measure is listed with a definition to the right. Now, one thing I'd like to point out is this page also includes tooltips. So if we were focusing on nursing home CDI, I can see that that is a rate of long stay residents with a C. diff infection, a numerator being number of long-term care onset CDIs over the number of resident days. And if I hover over this box, it's going to provide me additional information in the tooltip. So I can see information about the data trend, the measure type, the per unit, and the time period. So in this case, I can see that the data trend, lower is better. And then I can see the measurement type. We are looking at a numerator over a denominator multiplied by 10,000 resident days. I can see that per unit is also included, the per 10,000 residence days. And then I see that the time period for this particular measure is 1 month. Now, if I look down maybe at nursing home UTI, again, it's going to provide me that level of detail on the data trend, the measurement type, the per unit, and time period. but I can see in this case that the time period is 12 months of data. So that's where we're getting that rolling year versus an individual month. And again, if you want to see specific definitions, you need to go to that page and then click the measure definition link. So it's filtered down to whatever measures are applicable to that page. Now, if you need more detailed information, that is included here at the top under resources. So you can click that resource link at the top of the page, and that's going to bring you to our encyclopedia of measure documents that provide specific information about maybe numerator and denominator codes that are associated with various measures. So it's going to give a lot more detail than what you'll see in the dashboard. The dashboard is just meant to give you brief information, and then again, more detailed information may be found under the resources tab. So I want to take a moment to see if there are any questions. Doesn't look like we have any questions in the chat. Michelle, is there anything?
Yeah, no, I don't see any questions either. I wonder, maybe, you know, the NQIIC ID, when you showed it at the beginning, and the, you know, you're using our test site, Midwest, I forget what it's called again, but it said for NQIIC ID not available because we didn't assign one for our test one, but maybe like explain from the perspective, but then you used several different NQIIC IDs just for this demonstration. So, but a participant, they would see, when they go in, they would see their organizations and they would see the NQIIC IDs that they have access to, meaning when they go to look it up. So if you want to, you know what I mean, explain that.
I can show that again. Yeah, so again, the NQIIC ID can be found under your username in the top right corner of the page, and then you'll select My Entities. Now again, the entities list is filtered to any sites that you have access to. So if you're overseeing several clinics, you will have access to those in KeyMetrics, and then those will all be listed here. So you will likely see a couple facilities. Some individuals may only have access to one, and that's okay. So for each individual facility, you just need to click the entity name, and that's going to open up the additional identifiers, and then you'll see that NQIIC ID. Now, as Michelle mentioned, our Midwest Superior Care Center site is not tagged to a specific NQIIC ID, but again, when you see your individual facility, you will have an NQIIC ID provided here, and it's going to be that 6-digit number. And as Michelle mentioned, I used various NQIIC IDs as examples just to help filter the data down and show the functionality of the dashboard, but likely you'll select the same NQIIC ID for each page, so you can view information specific to your facility.
Yeah, thanks, Andrew. And it's not the same as the KeyMetrics ID that you might see more prominently, but it's the actual NQIIC ID, which is an ID that's not public, so that it's unique to your organization.
Correct.
Yeah, I don't see any other questions.
Okay. If nothing else, we can wrap up the dashboard portion here. One thing I just want to point out, just as a reminder, for right now we're conducting various organizational assessments for the nursing homes as well as our other community participants. And we have various organizational assessments available in KeyMetrics, and that will be filtered based on your facility type, whether you're a nursing home or if you're one of our community participants that falls under a clinic, hospice, home health, a hospital. And what we're doing right now is we're collecting information through these surveys to help identify potential gaps and opportunities for improvement. So as you complete the survey, it'll help you identify those potential gaps and opportunities. And then it provides us with critical information so that we can understand how to assist you based on the needs of our participants. So what it does is it allows us to provide specific education and resources for you to meet the quality improvement goals of your organization. So if you have not done so yet, I encourage you to log into KeyMetrics and complete the organizational assessments. And I'm going to bump back over to KeyMetrics really quick, just so we can see where that's housed. So if you click on surveys at the top of the page here, and on the main page, you'll either see the nursing home organizational assessment or the organizational assessment, depending on your setting. And then all you'll need to do is click your facility name. This will open up the current survey, and then you can click edit to look at the first half of 2021, and then you can complete those questions that are included in the survey. So, and if you have any questions, you can contact us. There's a contact us link here. And our email address is keymetrics@superiorhealthqa.org. So that concludes our presentation for today. Again, if you have questions, you can contact KeyMetrics@superiorhealthqa.org.
Thank you so much.